Dr. Cass, I want to begin tonight with this new reporting about how coronavirus might be affecting children. Have you seen any of these cases, or have they been reported to you in your practice in New York?
Yeah, so these cases are being seen in New York and the hospital I work at. Friends of mine who work in the pediatric ER and in the pediatric hospital have been seeing them as well. What we know is that actually it mirrors similar symptoms to what we see in adults, although we really don't know very much about it, which I think highlights the larger picture, which is that we don't know a lot about what this virus is doing to anybody. We don't know what the long-term effects are. If this is actually something that happens after you recover from the virus and not part of the active infection, then that shows us how much more we need to stay home and learn more about this virus before we just declare that we've, mission accomplished, which seems to be the messaging coming out of the federal administration.
So, Doctor, what do we say to parents now? They were worried enough. They're worried enough about their own health. And I think parents had kind of a right, based on public information, to be relatively relaxed about the kids, especially elementary school age kids. This story says we really have to pay attention when kids that age have any kind of symptoms.
So I think that this story and this reporting really needs to be put into context, which is still very, very rare to see these syndrome at all in children. It's much more common for a child with a fever and abdominal pain to have appendicitis. But both of these conditions, whether it's this inflammatory condition or appendicitis, should be evaluated by your doctor or in an ER. One of the things we're reminding people is that our emergency departments are open and we are ready, willing, and able to take care of all the patients that need us, not just those with coronavirus. So if you're concerned about your child, call your pediatrician, call a telemedicine visit, or just go to the ER.